We're going to switch over now to the Ryan brothers, Pat Ryan and Matt Ryan, and they're going to continue the journey. So food has been produced, whether it's a commodity or actual real food, and it's now about to hit your mouth. And here Matt is a respiratory physiologist and Patrick is a dentist, and they're going to talk about the importance of real food for craniofacial development, especially in children. So how are we going on the technical side of things?
Yeah.
Okay. I'll get out of the way, and Matt and Pat are taking over.
Thanks, Liz. Do you want to stand here the whole time while I'm talking?
No, not really.
You can. We're going to take turns. Okay. So, hello, Low Carb Canberra. Thanks for having us back again. We're really excited to be here. For those who saw my talk from last year, elements of it will look the same. I assure you that there is more information in here. We just have to build those same blocks as we get into it. By way of introduction, my name is Matthew Ryan. I work at a Canberra-based dental practice, which is family-owned and run. In fact, the three, my two brothers and I, so the three brothers of our family, all work in the practice together. So because my father is the owner of that practice and principal practitioner, it gets very interesting at dinner table time. The conversations tend to be very specific. We are new age dentists. I'm not a dentist. That's the first thing I should say, actually. I'm not a dentist. I teach people how to breathe and swallow properly. But the important thing that I'd like to get across to people is that dentistry is not what it has always been. It can, should, and could be much more, and I think that it needs to be. And part of our presentation today will hopefully get that across to people, that what's being called dental medicine in other parts of the world is very important. And I always like to think of it in terms of the difference between the university time spent for doctors and for dentists. Poor old GPs or any medicos that go through med, they spend 5 years learning the entire body. My brother goes to uni for 5 years and all he learns about is this thing. Okay, and so therefore anything to do with the craniofacial structure, so I'll say that a lot, that's cranium and face all together, really should be handled by people who have specifically trained in that area, and expecting everybody else to have as much information about it all as they is a little bit rough. The most important thing that we do in our practice that I think does make us relatively unique is we have a lot of different areas, and we are dentists, we're a dental surgery, but we don't do a lot of dentistry. The main focus for us is in guided orthopedic orthodontics, which is otherwise called dentofacial orthodontics. I'm sure Patrick has a different term. It's a wonderful area that Patty will show you the sort of ins and outs of. My role today is to present how it becomes necessary for us to be involved. The other part of our practice is specifically relating to chronic pain. So as you can imagine, a lot of chronic pain, particularly if you're out there thinking, yeah, I've got it, is facial, jaw, head, neck, shoulders, and back. And that all has to do with what we're going to talk about today. Patrick's main role in our practice is to help children not to turn into our adult chronic pain patients. So let's get stuck into it. The first part of this is the state of our species, or perhaps the state of the decline of our species. The image on the screen is a 7,000-year-old skull and what that 7,000-year-old man should look like. And then on the left there is the modern young male. You can see the difference. You don't need me to point it out for you. The important factor here is that pre-industrial humans for hundreds and thousands of years, according to the skeletal record we have had around about 1% crowded teeth. They developed strong bones, large jaws, open airways. That's healthy. When we look at what is happening now, we are seeing a collapse. The collapse in this case is evidenced by crooked teeth. That's so easy for people to see, so that's what we'll focus our attention on, crooked teeth. A fabulous dentist by the name of Weston A. Price went to Indigenous communities all over the world, took photographs, then came back after one generation from the introduction of Western diets, and we see the change. So perhaps now you understand a little bit as to where I'm going with this and why perhaps dentistry and crooked teeth may have something to do with a low-carb conference. So how much of this is this really a problem? This is very exciting time to be involved in all of this because the data is really coming through. We've understood the basis for a lot of this for a long time, but it's really only now that we're getting an idea of the scope of it, and the science can barely keep up. We know that it basically, this is crowded teeth, didn't exist until about 300 years ago. There's a wonderful anthropologist who's a pediatric dentist called Kevin Boyd. Go and look him up. Fantastic stuff coming out. But the current rates of crowding in children are as far from our pre-industrial ancestors as they could be. It's basically 90%. 90% of the children in Australia right now have crowded teeth. So the next question, and I know you're asking it, is who cares? Well, I don't really. You probably don't care if your teeth are a little bit crooked, unless you're planning on being a Hollywood actor or something like that. It's not a massive deal for you. The problem is that it's not about crooked teeth. The teeth are a marker. They're an indicator for the health of the entire craniofacial system. We are seeing such a rapid I call it de-evolution, but we're seeing such a rapid progression into what we call craniofacial aberrance. And this is a wonderful photo from a book called Jaws by Sandra Kahn, which is an explanation in and of itself of the change within a very short time frame in facial structures. What we are talking about is crooked teeth, but it's not just about crooked teeth. If your teeth don't fit, so they're crooked, it's because your jaw is too small or too far back. If your jaws are retrognathic, so locked backwards, your airway is compromised. You have to go somewhere. Good airway health means you have to have ideal jaw size, shape, and position. Poor airway health is because those jaws are out, and that means poor breathing, swallowing, and sleep. The images at the bottom of this one are just, it's pick one, right? But this is just a great little example from a good study of 3 children with airway obstruction to differing degrees. And hopefully you can look at those x-rays and you can say, okay, I don't know what I'm reading here. I can tell you there's adenoid issues in these cases. But you can look at the forward head posture that comes with it. And this is what I'm sort of teasing us towards, is it's crooked teeth as a marker, but it's not about the teeth. It's about the jaws, but it's not about the jaws. It's about breathing and swallowing that we have to do to grow those jaws. It's about the airway. If you look at the magnificent orthodontic result in this case, you look at what they have done for this man's smile, it is spectacular, okay? We've got horrendous crowding, crooked, whatever, and then we've got a magnificent recreation of normal teeth, but look closely. The airway size. It was a real problem before he started and it's a real problem afterwards. So it's not so much about the teeth, it's about the airway. And I'm going to say it like 50 more times so that we all get that idea. If you see someone with crooked teeth, there is a high likelihood they have an airway compromise. If you see a child with crooked teeth, there is a 92% chance that they have sleep disordered breathing. We're looking at airways. So let's see how we got here. I'm going to fly through this because I did do it last year, and whilst it's very interesting, it's also stuff that's very easy to look up. So I'm going to zoom through this so we can get into the real guts of it. The first thing is hold up your hand, look at it, and hold up your other hand. They're the same. Okay, you don't need to do anything. You don't need to breathe on it. It will grow. As you get older, it grows. When you get to a certain point, it stops. Hands always look the same. It's not as though fingers just grow in random directions. If only our jaws were the same. Your lower jaw grows like your hand in the sense that it will always develop to full size. When does it stop growing? Well, your guess is as good as mine. The understanding is somewhere between about 20 to 25 years, but there is some evidence to suggest that perhaps it never stops. So the lower jaw develops regardless of your function. This is not the case for the upper jaw. The upper jaw will develop only from nasal breathing pressure and pressure from the tongue resting in the palate and swallowing appropriately in that position. So reiterate, you cannot grow your upper jaw and your midface unless you are nasal breathing for the first 12 years of your life. Therefore, if someone is crowded, say, I don't know, 90% of the child population, that tells you straight away that 90% of the population, if this is right, is likely to be breathing and swallowing inappropriately. The very things we do all day, all night, every night. This is why it's such an impact. It is very under the surface. The lower jaw will always grow, but you can see those arrows. It will not always grow to the same shape and position as it ought to for that person's genetic potential. It needs to. If the upper jaw does not grow appropriately, the lower jaw will be forced to grow into another position. It will be forced back. It will be forced into a position that creates more of the functional problem. Okay? We've all seen Napoleon Dynamite, know what he looks like. The problems that we have, what does this mean? If we really take a step back and look at it, we have issues with breastfeeding in modern society. In particular, there is some evidence to suggest that we should be feeding our babies upright. Not going there, we'll talk about it maybe another time. Chewing, lack of chewing in early childhood, purees, that sort of thing. Not giving our babies Stone Age diets. Nasal breathing, lack of nasal breathing, and just broadly a lack of sleep. You put it together and what starts to occur is the list. Okay, I don't expect you to sit there and read the whole thing once there, but it's there. You can go back and look at it later and pause and go, oh yes, I see what he's talking about. The important thing here is you don't grow properly if you're not doing these things correctly, and they're not up to us because it primarily happens as children. The body learns that it cannot breathe through the nose for whatever reason. It feels like it needs to mouth breathe. Mouth breathing air is poor quality. You get so much better air through your nose. It is conditioned, it is warmed, it is wet. By the time it gets to your lungs, you're getting 30% more nitrogen out of it. You're getting 20% more oxygen per litre that you breathe. So next time you're running cross country, run with your mouth closed. The other side of this is that as your body then gets used to this poor quality air, it has to breathe more. It has to breathe more air to get more of the good stuff out of it because it's not being conditioned. So increased volume of breathing becomes normal. Okay? It's habituated. This is where things start to go really awry. If you want to breathe through your mouth, you have to drop your tongue to the bottom of your jaw. It's not where it's meant to be, but it'll go there. You will force yourself to swallow with your face rather than with your tongue. You'll actually shift the nerve that you use to control your swallow pattern. You have to breathe, you have to swallow, you have to chew, you will find a way. This changes your chewing, it changes your swallowing. We've all seen kids that eat like that, okay? They're trying to breathe too much, they have to have their mouth open while they're eating. They've got their tongue in the bottom of the mouth. It's just like a dead fish in there. It can hardly fit inside anymore, so it just flops around. We can't make bolus properly with our tongue. So that's like a little cocoon you make with your food before you swallow it. So you could just shove food in, you just shovel it, okay? And it just goes and goes and goes. It is unlikely that this is going to self-correct. Okay, so where do we go to from here? So you've got the start of this process, a little bit of mouth breathing, a little bit of low tongue posture. Who knows why, but it's happening, okay? Then you say, all right, well, what is the big deal with this whole airway link? You know, how does having crooked teeth and small jaws and mouth breathing get to this point? Well, this is how, okay? MX means maxilla and MD means mandible. So maxilla is the upper jaw and mandible's lower. So you got normal growth, okay? Something shifts. All right, so the upper jaw doesn't develop as well as it ought to. The lower jaw is being forced backwards. You get airway compromise, and as a result, you're going to get forward head compromise to open that airway. This cannot make itself better. By the time you get into that posture where the shoulders have come forward and your head is forward to open that airway space, it can only get worse, and it does. The weight of the head is really, really extreme. Go and get a bowling ball and hold it up one day, I've got one in my room with it on a stick. It's great. I make all the kids try and hold it up. The thing is that as it goes further and further forward, for every 7 degrees of forward lean that you get on it, you're getting an increase in weight that's exponential. So every time you see an old person who's walking around like they hunch, it's not because they're old, it's because they were slightly further forward when they were young. I've got 2 grandmothers, they're the same age. One's all hunched over and the other one's straight upright. Okay, there's a difference in the way they've developed, not in the fact that they're old. This is where we end up. We change our ability to breathe correctly. Because of changes in function and behavior, because of the habituation of those aberrant patterns, we get into this position, okay? There is a lot of scary stuff out there with regard to sleep disorder breathing, so I don't need to go into it. And it is a bit doom and gloomy, but this is what we've got to get across. We're back here, okay? We're back in this situation. So we've got a growth problem because we've not been breathing properly. But because we're not breathing properly and we have a growth problem, it makes us not breathe properly. It's very hard to breathe super well if you've got an airway compromise. Your upper jaw is super narrow and your sinus is being compressed by the roof of the mouth. Remember, the floor of the sinus is the roof of the mouth. So these processes that we went through are getting worse. They're getting worse and they're worse. You're not chewing, you're not swallowing, you're not breathing, you're not sleeping well. And so things start to spiral. We get to this position where we are right now. What is going on? All right, so now we know, right? If you've got crowded teeth, you've got a breathing, swallowing, and chewing problem in your childhood. Now, the problem with this is that once you've completed your childhood growth, it's still a problem because it just gets worse. At the very least, from today, stop it. Stop it from getting worse. That doesn't mean that you can correct it. That's what Patrick's for. But the important thing here is that you can stop it from degenerating further, and we have to. So, where are we going? I know where we're going. Everyone says, yeah, but it's genetic. Like, I hear what you're saying about breathing and stuff, but it's genetic. Elements of it are. Everything's always got an element of genetics. But I'll tell you a quick story. And this is, when was this? Like 2 weeks ago? Yeah, like just a couple of weeks ago. Young girl comes in. And she's got a genetic disorder. And one of the comorbidities that's just basically 100% of the time with this genetic disorder is facial dysmorphia. Okay, so basically what we're talking about is craniofacial growth dysfunction. Okay, so we get to this position where we're expecting this. Now, we also know that she used a dummy until quite late in life. She had trouble breastfeeding when she was little, and that she was a finger and thumb sucker. So you read the history and you're like, uh-oh. She comes in, she hops up in the dental chair. Patrick looks in the mouth and goes, I think I've been given the wrong information for this patient because this is a perfect jaw structure for this age. No, that's definitely the patient. So he's sitting back going, how this doesn't make any sense. The genes are there, everything is there. Why is the history being why is the genetics and why is the history being overridden? This little girl's condition, she loves to have things to play with and fiddle with and that sort of thing. For her, her comforter was a little chewy that she had around her neck on a string, and she would chew on it all day, just chew, 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 chew. Beautiful face. Her sister, who didn't have the same genetic anomaly, let's say, that causes or tends to cause this facial dysmorphia, needed treatment. Okay, so there's a genetic element, there always is, but it's primarily functional, and it's not just us. There was you can't do this sort of study anymore for obvious reasons, but there was a wonderful study done on rhesus monkeys. They just blocked their noses when they were little. It was horrible, and it changed the way they behaved, fed, and grew. And you can see the difference. I mean, it's hard because it's such a long time ago, so the photos aren't amazing, but you can see the difference. Big, wide, lip seal, nose breathing, long, narrow face, okay? Because the baby monkey was mouth breathing. More than that though. So look at the pictures across the top. You see how the jaws come together and the tongue is trapped inside the jaws. It'll be resting in the roof of the mouth. Now, apes have quite a different setup in there, but the principle is the same. Anybody who knows what a anterior tongue thrust looks like knows what those pictures are, okay, at the bottom of the screen there. This is a tongue thrust from an anterior open bite caused by the upper jaw not developing enough because the baby monkeys were forced to mouth breathe. They started to tongue thrust when they swallowed. That's what pulls the lower jaw back for many children, okay? So it's not just us. It's not this sort of weird microcosm. It's not something that's a mystery. It is quite clear. So what has this got to do with low carb Canberra? Okay, yeah, it's really interesting, but how does this come back to what you're all here for, which is learning how to make really good food decisions? And this is, this is where it starts getting really cool, because we've established that there's this breathing and swallowing role to play in the fact that we've got 90% of children with crowding. We know that crowding means there's a high likelihood of airway compromise, sleep compromise, and all the rest. That's there, that's done. But why? Why now? Why is it happening all of a sudden after hundreds of thousands of years of developing beautiful faces? Primarily, it's because we've never needed to evolve an alternative. We can only grow our face from breathing and swallowing and chewing because we've never needed another way to do it. Maybe we will. Maybe we're just accelerating our evolutionary sort of journey into being able to do it. Maybe we'll lose more teeth so we don't have to make our jaws so big. But for the moment, we've got to ask this question: how is it occurring? Weston Price's work was fundamental in establishing this, but he established this in 1920, 1930. What we shouldn't still be having to sort of find out about it. This is a great picture of a skull from someone in the early 20th century compared to skulls, much thicker skulls from later on. And there's stuff to do with this image, but it's just a good way of looking at how our bone density is changing because our diets are changing, okay? We look at it, our bone density is decreasing, our tooth decay is, that's why you got fluoride in your water, you shouldn't need it. You got fat-soluble vitamins reduced in our diets. That's what we used to have all the time. Vitamin D deficiency, only sort of 30, 40 years ago, was laughed at. And now we know, oh yeah, it's real. Okay, and this is where this is coming from. So you've got to chew, you've got to swallow low-carb, real food diets to help your bones and airways to develop. We were built for Stone Age diets, not purees and not fast food. And obviously we're getting to know this, right? We are getting to know this, but this is how it affects this part of you. So we have to make better food choices, but there's more to it than that. It's not just what you eat, it's how you eat it, okay? This is a wonderful example. I think I showed it last year. She's great. It's one of our favorite cases. We don't know why, but this young girl developed an aversion to chewing on the left-hand side. If you look very closely, where Patrick's put out those red rings for us, you can see how one side of her maxilla, her upper jaw, is actually really well developed. Looks great. And then where that red ring is on the other side, there's just no teeth. So the first thing you look at that and you go, what is going on? This doesn't make any sense, okay? But it does when you get the history and you find out she just doesn't chew on that side. She didn't erupt her teeth because she never chewed on them, okay? Function. Function drives growth. That changed everything. It changed the way that her jaw sat, the way her head sat, the way her shoulders, neck, back, all the way down to her feet. Okay, she was destined for so many problems. I mean, we just got her to chew on that side and change a few things, but function, it's a wonderful example. So the second part of it is how you eat. This is what dentists have been saying for a long time. Chew your food. Chew it slowly, okay? Smaller pieces of food, 20 to 30 chews before you swallow. Whilst you are chewing and creating your bolus, you are pre-producing digestive enzymes. It's an early warning system. You're saying to your gut, guess what? This is what's on the way. And the gut goes, yes, thank you very much. I will get ready. Okay? If you just go and swallow it and down, it just goes boom. And the gut goes boom. And it tends to overproduce. And a lot of that overproduction of enzyme is responsible for inflammatory conditions and that sort of thing. And it's not my place to talk about that sort of thing, but that is where it comes from. And it's this regulation of your oral biome that's getting a lot of press now. So it's not just your gut biome, right? It's your gut, it's your brain, it's your lungs, and it's your mouth. And they all talk to each other with light. That's cool. But the thing is that the oral biome is primarily sort of, I suppose, hindered by changes in pH. And the big shift in oral biome health that we're seeing has been linked to mouth breathing. Okay, so you've got to take care of your oral biome if you want to do its work. Close your mouth, okay? If you are mouth breathing, you're going to destroy it. Also, watch out for anything that has antibacterial agents in it. You wouldn't put hand sanitizer in your mouth, so do have a think about whether or not mouthwash and things like that is the best thing to be putting into a very sensitive biome environment. One of the big factors, in I think a lot of the discussions this weekend and to do with diet generally, is that difference between physiological hunger, where you're actually hungry and you need nutrient, versus psychological hunger. And that's a big one. That's a big one to tackle. And I'm sure Jess spends a lot of her time dealing with that. But one of the things is that part of doing this will help you to understand a little more about what it is to be sated. If you chew more slowly and you really focus on this from the perspective of your oral biome, the development of your jaw, making sure your tongue's right, all this sort of thing, which is so important for you, which I'm hoping you're getting, as you're doing that, it's conscious eating. That's what the psych suggests for treating diabetes. It's so important as a way to sort of make you realize, well, actually I'm full, okay? So next thing, it's not just what you eat, it's how you sleep. So if you're not sleeping enough, most people aren't, if you're not sleeping well, suddenly all these dietary choices that you're making are less effective. Okay? I mean, it's more a matter of just sort of chuck something out there and you pull up some great stats on sleep at the moment. Everybody loves it. But the big factor that we want to take away from here is regard to children. This is a disaster. If it is true that by 2025, 80% of children in Australia are going to have sleep disordered breathing or a sleep disorder that is diagnosable, we're in real trouble if these stats on your screen now are the case. Okay, so it is frightening, absolutely frightening. We know now that a very large percentage of ADHD and other learning difficulties are often just misdiagnosed or sometimes just improperly diagnosed sleep disorders. You've got to get enough sleep. You've got to have your lips closed. You've got to have your tongue up and your airway has to be open enough for you to sleep well. The last part of it is if you end up in this situation, okay, it's a spiral downwards very quickly. And so we have to make sure we stay above it. And a big part of that is environment. So it's not just what you eat, it's where you are eating it. And this in particular is where a lot of new research is going, particularly into mitochondrial health. Okay, and we are learning that essentially environment is key. We are also learning that the modern environment for humans, it turns out, is not so good for us. Not enough sun, too many screens. We have excessive blue light exposure, which affects our sleep and it makes us anxious. The studies have been done. We have to see the sunrise every morning. We have to reduce our blue light exposure, which is quite funny as I'm standing here doing this, using this marvelous tech to be able to get the message out there. But it still stands as a thing. We don't need to all go and just live in yurts in the bush and grow our own food. It would be awesome for us if we did that. That would obviously be really good for our health. However, we've got to make this work. And this is often the hardest thing to get across is like, oh, this is really important, it's really interesting, but what do I do? Like, how do I, put this in? Well, one of the first things you can do is you can control the environment of your sleep. Okay, so when you go to bed at night, make sure it's dark. Stay away from your screens and that kind of thing. Turn off your Wi-Fi. All right, and I know that's not going to come across very well. A lot of people are going to say, "I'll take your tinfoil hat off" and all that kind of thing. But who's more crazy? The person who's standing back going, "There is no possibility that high-frequency radiation and 5G and all that sort of thing can possibly harm me or my sleep," or is it a little bit more crazy, a bit less crazy, perhaps, to have a look at it and say, rates of chronic illness are increasing exponentially with time. We can barely keep up with it. It is occurring in younger and younger people, and it is frightening. When you start really looking at it, it can really be a bit macabre. It can be a bit doom and gloom. But when you start listening to the people who think that they have the answers with regard to some of this, and they say, well, don't have your phone next to your head when you're sleeping, and turn your Wi-Fi off at nighttime, and your body gets a break, and it turns out maybe it can heal some of that non-ionizing radiation. Regardless of where it's coming from, it can't hurt you. So this is the same thing with all of this. Take these small steps to change your environment, change your sleeping patterns and behaviors, change the way you chew, change the way you eat, change the way you breathe, change your tongue position. These things are easy, okay? Well, they're simple, sometimes not easy. So where do we go from here? The big thing that most people ask me is, how can this happen? How come our bodies are so badly designed or badly built or badly evolved that they can't sort this stuff out for themselves? We've established that crowding is a marker for airway health, lack of airway health. We've established that the development of the jaws and therefore the airway is purely based on breathing, swallowing and chewing. Okay, But why doesn't the body do the right thing? And the first thing is, it thinks it is, because it thinks it's keeping you alive. If you've got a child that's mouth breathing, it's not because they're choosing to be naughty, okay? Their body thinks they need to do it. Yes, it's going to become a problem, and it's not that hard to fix in most cases, but it's not because they're doing the wrong thing on purpose. It's not because, you know, essentially the system is broken. It will become so, but that's not where we start. We all start the same. The major factor here is that once you get enough along that track, it's very hard to come back. This was a wonderful study that was done on neonate rats, like the monkeys, right? They just block their noses and they just watch what happened. And you know, just go from the top, just go to the bottom. Okay, look at the bottom. All right. You've got an issue with the thyroid axis and the adrenal axis as a result of HPA issues. Now, we don't need to go into what all this means, but you've got growth, learning, feeding, social, and then you've got stress issues. This is why it's so hard to come back from these problems. It's easy to step in and change it early, and it's not hard to change the base levels, but it can get tough once it gets enough progressed. Kids, they just never get a chance. Their growth is affected, then their airway, then their sleep, then their learning and their behavior and all that kind of thing goes as well. Then it's their immune system. They're inefficient, they're dysfunctional, very difficult to develop well. Then you've got all of the environmental factors that come along with excessive screen time and all that kind of thing with regard to sleep times and sleep patterns. For an adult, okay, so it's easy for us to say, give us a child, we'll step in, make the changes, get them growing properly. Yes, okay, we've got it early enough. What about for an adult? You're finished growing. Step one, don't let it get any worse, okay? And step two, there is a lot we can do, okay? There is a lot that you can do. It starts with changing your diet. It then becomes how you eat, what you eat, where you eat it. So we know, for example, that once you go through these processes and you get all these issues, you're going to get into a position where it's hard to know where to start to come out of the hole that you're in. I always say to everybody, line up your boxes and start ticking the ones that are free and are easy. Your nose is free. So is your tongue, okay? Your ability to have your phone away from you, to go to bed when the sun goes down, to wake up with the sunrise is free, okay? Work on it. Make it change now before, as a species, potentially we get to the point where we can't come back. Very doom and gloom, isn't it? So the big focus here is, what do you do? Like if someone was watching this video and they're like, okay, but what do I do? Well, first of all, you know, come and talk to me, because this is like a blip. This is a microcosm of what we could talk about. But the other side of it is, start with your diet. Start with your diet, and it doesn't matter what age you are. You've got to go low carb. I don't have to say, oh, this is what you have to do with your diet, because this is what the whole weekend is here for. Start with that. Make sure that you are breathing through your nose. Start practicing putting your tongue on the roof of your mouth. Click your tongue off the roof of your mouth and associate sucking your tongue there with clicking. Everybody can do it. If you can't click, you just have to find a way to learn how to do it. Do it in the mirror. Say the letter N. Say in the back of your throat. Say them both at the same time. There are heaps of videos about how to do this. Tongue position is key. Everybody give it a go. Just give it a go. Click your tongue off the roof of your mouth a few times. And you'll feel like when you do a click, you kind of suction it to the roof of the mouth before it clicks down. See if you can hold that suction. And you should feel like you're working hard to do it if you don't normally do it, but it becomes easier with time. It's supposed to rest in that position all the time. Hold it in that position. Open your mouth, pinch your nose, and try to breathe through your mouth without dropping your tongue. And you'll see why it all goes together. Okay. So we have to make sure that our sleep hygiene is good, and we have to make sure we're getting some sunlight in the morning. The next part of it, you've put all this in process, but you've still got issues, whether it's pain or difficulty with weight loss or sleep. Come and see us. See some of these people out there now doing dental medicine. Check your temporomandibular joint for dysfunction and compression. Have your airway checked. Check your intraoral cavity space. There's not much point telling you to put your tongue up if you can't fit it in the roof of your mouth. That's when you need Patrick. Breathe well, eat well, and sleep well, and you will be well. One of the things that especially after I just go bleh and verbal diarrhea all over my patients and parents, is they say, where do we start with this? You know, what do we do? And I just got my 3 easy peasies, okay? The first is breathe through your nose all day and all night. If you're having trouble with that, go see your ENT or do some investigation into what's going on. Always remember, your nose is use it or lose it. Using it dilates. Number 2, see the sunrise. Avoid the screens, particularly at nighttime. Eat less often with a stick. And what I mean by that is, if you can't dig it out of the ground with a stick and you can't hit it on the head with a stick, don't eat it, okay? Always remember, with all of this, if you finish hearing this and you're just stressing, you're stressing about, oh, my breathing, I'm sorry, I can't do this, and oh, my child, and all that sort of thing. If you hear all this stuff people talk about this weekend, and it's just too much, and you can't get your head around it, and you're just like, I don't know what to do, I'm now really worried about not eating that and not eating that. Oh, no, I can't eat that, and I'm going out with my friends, what am I going to eat? Stressing about eating badly is worse for you than just eating the bad stuff, okay? So remember that all of the time when we come across like this and we're saying, oh, it's terrible, we're all going to die, the most important thing to take away from it is we wouldn't be talking about it if we didn't have some kind of solution in mind. So I think I'll leave it there. I better stop. Okay.